All right, hi everyone. So this is a follow-up training presentation on cancer prevention for firefighters. And now remember from the initial presentation, we talked about keeping your body systems healthy and checking into your own body's ability to detoxify. So of course, the initial place to start is a blood test interpreted by a doctor who's looking for the obvious and also the subtle indicators of developing health problems. Beyond that, there are two particularly useful tests that you should consider and were recommended in the program. So the first one I'm going to show you because it's a little bit out of the mainstream test. And it's a heavy metal test. And then of course the second is this genetic test, both of which have the intent of identifying your body's barriers and abilities to detoxify. So heavy metals can accumulate in your body's tissues, fat, and bones either acutely or over time and contribute either directly or indirectly to illness. So heavy metals can interfere with your body's ability to detoxify. Remember that from the program. So toxins interfere with cellular growth and are known precursors of cancers. It's probably not a stretch at all to think that firefighters as having maybe elevated levels of heavy metals because we're exposed to them as byproducts of combustion. And they're also easily absorbed, so all three routes of absorption are possible with heavy metals: inhalation, ingestion, and through the skin. Heavy metal toxicity is implicated as a possible reason for increased incidences of cancers in firefighters. So if you're looking into, your ability to prevent yourself from getting cancers as a firefighter, this is something to think about. So in this presentation, I'm going to explain how to take a heavy metal test because they're a little out of, like I said, a little out of the mainstream medical test. You get a kit like this from a doctor who specializes in this type of medicine, such as Dr. Tolzman, who did our initial cancer prevention presentation. You have to do a little bit of pre-test preparation before you can take one of these types of tests. So you take something which is generically called a provocative agent starting about 2 weeks prior to the test. And for this test, the provocative agents, they draw the heavy metals out of your tissues where they're being stored and causing, potentially causing you harm, and put them back into circulation so they can be seen in the test. And for this test, the provocative agents are something called glutathione, DMSA, and glycine, which you get when you go pick up the test. After you follow the directions given you for the 2-week period, you simply wake up in the morning that you intend to take the test and urinate into the test collection container provided. So this is your pre-test sample. So wake up in the morning after you've done your 2-week pre-test, you urinate into this. Next, you take an adult maximum dose of DMSA, which is, again, a provocative agent. And for the next 6 hours, you collect all of your urine in the second kit's container as provided. So you've got a pre-test kit, a post-test kit. And again, the container that you urinate into, it's going to, it's one of these collapsible plastic containers. That's pretty self-explanatory. You keep the sample separated and put a sample amount from each container into one of these collection vials, and you have to label it appropriately. This is considered a medical sample, right? It's body fluid, so that means that FedEx has got rules for sending this stuff through to their next location, which is the lab. So they go in a clinical pack, appropriately labeled as such. And so you can't just drop it into just any FedEx drop box, but it's easily done. And a few weeks back, you get the results. Okay, so something like this, right? From there, you develop a detox plan on how to reduce them in your body. This can include chelation therapy, sauna regimen, or simply taking some supplements to kind of help your own body detoxify some of this stuff. The good news is that there usually is something that you can do about it, right? So there is something you can do to reduce the past exposures that you've had. This is advanced cancer prevention for firefighters. More in the next segment on how to take a genetic test. All right, take care, everyone.